When an infection becomes life-threatening, don't ignore the warning signs. A wound gets infected. Someone develops pneumonia. Someone has a urinary tract infection. At first, it may seem like something that can simply be treated and forgotten, but sometimes the body reacts to an infection in a way that becomes dangerous. The person may suddenly become extremely weak. Their breathing may change. They may become confused or unusually sleepy. Their heart may start beating very fast, and their condition can deteriorate rapidly. This serious condition is called sepsis, and one of the biggest problems is that people may not recognize what's happening until the person is already very sick. So today on Health First, we're going to break down what sepsis actually is, how an infection can lead to it, the warning signs you shouldn't ignore, who's most at risk, and why getting medical care quickly can make a huge difference. Because sometimes knowing what to look for can be just as important as knowing how to treat an illness. What exactly is sepsis? Let's make it very simple. Sepsis is a life-threatening medical emergency that happens when the body's response to an infection becomes harmful to its own tissues and organs. Normally, when germs enter the body, your immune system fights them. That's a good thing. Your immune system is supposed to protect you, but with sepsis, that response can become uncontrolled. Instead of only fighting the infection, the body's response can cause widespread inflammation and other changes that can damage organs. And this is important. Sepsis itself isn't a type of germ. It is a dangerous reaction to an infection. The infection can start in different parts of the body. It could begin in the lungs, urinary system, abdomen, skin, or somewhere else. As the condition becomes severe, organs such as the kidneys, lungs, heart, or brain may stop working properly. That's why sepsis should never be treated as just an infection. Someone with an infection who suddenly becomes seriously unwell needs urgent medical assessment. The earlier sepsis is recognized and treated, the better the chance of preventing further organ damage. Where does sepsis come from? Now you may be wondering, where does sepsis actually come from? Sepsis can begin with an infection almost anywhere in the body. One common source is the lungs. For example, a serious case of pneumonia can sometimes lead to sepsis. Another source is the urinary tract. An infection that begins in the bladder can sometimes spread and become much more serious, particularly if it isn't treated appropriately. Sepsis can also begin in the abdomen, including infections involving organs such as the intestines or gallbladder. And don't forget the skin and soft tissues. An infected wound, abscess, or other skin infection can sometimes progress into a serious infection. But here's something important. You cannot look at an infection and automatically tell whether it will become sepsis. Sepsis can happen to anyone with an infection, although some people have a higher risk than others. So don't wait for an infection to become dramatic before taking it seriously. If someone with an infection is becoming significantly more unwell, they need medical attention. How does an infection turn into sepsis? Imagine you have an infection. Your immune system detects the invading germs and immediately starts fighting them. Normally, this response helps your body control the infection. But in sepsis, the body's response becomes dysregulated. Instead of staying focused on the infection, the response can trigger widespread inflammation and changes throughout the body. These changes can affect blood vessels and blood flow. As a result, tissues and organs may not receive enough oxygen and nutrients. This is where things become dangerous. The lungs may struggle to work properly. The kidneys can become impaired. The brain can be affected, causing confusion or changes in alertness. The heart and circulation can also be affected. In severe cases, blood pressure can fall dangerously low, and the person can develop septic shock, a life-threatening form of circulatory failure. And this is why sepsis can progress quickly. It's not simply that the infection is getting worse. The body's response to that infection can start causing widespread problems. That's why a person who initially seemed to have a manageable infection can suddenly become seriously ill. Who is more at risk? Anyone with an infection can develop sepsis, but some people have a higher risk of becoming seriously ill. This includes newborns and very young children, whose immune systems are still developing. Older adults are also at higher risk, especially those living with other health conditions. People with weakened immune systems can be more vulnerable too. This may include people receiving treatments that suppress the immune system, or those with certain medical conditions. People with chronic conditions such as diabetes, kidney disease, lung disease, or cancer can also have a higher risk. Recent surgery, hospitalization, or the presence of certain medical devices, such as intravenous lines or urinary catheters, can also increase the risk of serious infection. But please don't misunderstand this. Being young and healthy does not make someone completely immune to sepsis. Sepsis can happen to anyone. What should you do if you suspect sepsis? Don't wait and see if they will get better on their own. If someone has a suspected or known infection and is becoming seriously unwell, especially if they're confused, struggling to breathe, extremely weak, unusually sleepy, or deteriorating rapidly, seek urgent medical care immediately. Tell the healthcare professional that the person has an infection or may have an infection, and explain what changes you've noticed. If they are already receiving treatment for an infection but their condition is getting worse, don't assume that the treatment is working simply because they've started medication. They need to be reassessed. Can sepsis be prevented? Not every case of sepsis can be prevented, but there are things we can do to reduce the risk of serious infections. First, take infections seriously. If you have a wound, keep it clean and watch for signs that it's becoming infected, such as increasing redness, swelling, warmth, pain, or pus. Second, stay up to date with recommended vaccinations. Vaccines can help prevent some infections that can potentially lead to severe illness. Third, practice good hand hygiene, especially before eating, after using the toilet, and after caring for someone who is sick. If you have a medical condition that increases your risk of infection, follow your healthcare professional's advice and keep the condition properly managed. And perhaps most importantly, don't ignore an infection that is getting worse. A small infection doesn't automatically become sepsis, but when someone is becoming increasingly unwell, getting medical attention early can be extremely important.